All right, welcome everybody. We appreciate you being here on very short notice, and we greatly appreciate Dr. Lisa Santora being here to give us an update on our sports guidance from our public health office. So take it away, Lisa.
Thank you. You can jump ahead, and I think this slide is up to date. So we wanted to have a meeting today with you guys because we know there's been a lot of conversations around masking and vaccination and testing, and wanted to have an opportunity just to check in with you since there has been a lot of conversations and movements happening at both the state level and at the local level. So as many of you know, we have shifted to following the COVID tracker from the Centers for Disease Control as our, I guess, standard measure of COVID-19 activity. And there was a change from yesterday to today. We were in moderate levels of transmission for more than 21 days, which allowed us to end the mask mandate. But yesterday evening, we went back into substantial levels of transmission, which then, according to the CDC, in communities across the country where there is substantial levels of transmission, they recommend that everyone continue to wear a mask in public indoor settings, regardless of vaccination status, though that is not a mandate anymore in our county. We expect over the next couple of days, we're going to probably bounce back and forth between moderate and substantial, but we are at high risk based on the current levels of COVID-19 activity that we're seeing and the results of testing that we're seeing, that for the next couple of weeks will probably just get more settled into orange or substantial transmission. That's driven by the change in weather as people have moved indoors, by the Halloween activities and more gatherings and celebrations happening indoors, events like outside lands, I think that's what it's called. I'm not from San Francisco or the Bay Area, as you can tell. That event and events like that are driving positive cases. So you can jump ahead. And this just shows you the activity that we are seeing, and consistently with what we've seen since the availability of vaccine is that case rates in our community are really driven up by our unvaccinated populations. And so even now, when you can see an uptick in cases in our community, it's primarily that orange line or those unvaccinated individuals that are driving up the case rates in our community, although we do have breakthrough cases in our community as well. You can jump to the next slide. So this is where we wanted to start first, is just providing a mask update. And so even though we went back in orange, we did meet the criteria for ending the mandate in Marin County. It's important to note that even though we're in orange, yesterday was the first day that there was no one in the hospital for COVID-19. And that's the first time in months that there's been no one hospitalized for COVID-19. So we are confident that we ended the mandate at the right time, even though we have shifted within a day back up to substantial levels, but we're not seeing the impacts on our healthcare system, which is critically important. I think it's one of the messages that has been missing in the media around the end of our mask mandate is that under California law, unvaccinated residents still need to wear a mask in all indoor public settings. It's the law that if you're unvaccinated, you need to wear a mask indoors. We know that's not the practice of many unvaccinated residents, and that once the mandate ended, unvaccinated residents will also not follow the order and will also enter into the public indoor spaces. We're with awareness of that happening, we're still confident that our healthcare system is strong and that there's not a need at this time to have a mandate, but to just have the state order in place and the recommendations from public health. It's important also note that nothing changed in the school setting. So the masking requirements are still required in indoor K-12 school, childcare, and other youth settings. Jump ahead. And so just to reiterate what the sports guidance is, that all persons playing indoor sports are required to mask unless there's a choking hazard. And I'll run through the list of what is the choking hazard. It's required, applies to all extracurricular activities that are operated or supervised by the schools and all activities that occur on the school site. And spectators themselves, regardless of their vaccination, must also wear a mask when they're indoors when students are present. Jump to the next slide. And these are the events that have been identified by the AAP, or the American Academy of Pediatrics, as choking risk. That's competitive cheer, gymnastics on the apparatus, swimming, diving, water polo, obviously, and wrestling. And the common question that we are getting is around basketball and volleyball, and these are not considered sports where choking is a risk. We know it might be uncomfortable for people playing basketball and volleyball to wear a mask, but it's not a choking risk. And you can jump ahead. And this we'll share the slide deck. This is just a link to all the references as it relates to the masking guidance. And maybe we can pause there and ask if there's any, before we jump on to testing, just to see if there's any questions from the group specifically around the masking guidance. All right. So I guess we can jump ahead to the next slide.
Hey, Lisa, this is Mary Jane. Hi there.
Oh, hi.
I have a question. Here's the question. How are we supposed to handle when our teams are playing against teams from other areas that are not following the same guidance? Because that seems to be one of the issues that continues to come up. We have a high vaccination rate. Our kids are following the guidance, and then all of a sudden they're in the championship and the other teams are not doing so. Has the Bay Area Public Health, sort of dealt with that at all? Because that seems to be sort of the controversial area.
We have discussed this as the Association of Bay Area Health Officers, and we all are holding firm and strong in our agreement to follow the state orders. We know there's going to be varying practice, but our expectation is that if there are events, athletic events and competitions occurring in Marin County, that all teams from either from Marin County and outside of Marin County will be following the guidance. And our expectation is when Marin County sports teams go to other counties, that they would also be following the state guidance, even if the practice is, even if individuals are not following the law, because this is a state order. Even if other sports groups outside of this county are not following the law, our expectation would be that our teams would be following the law when competing outside of the county. And that's consistent with the other Bay Area health officers. And we do expect this may change once we do have that a higher level of vaccination in the state due to the 5 to 11-year-olds being vaccinated. So we'll be looking forward into potentially mid-January for a potential update in state guidance as it relates to sports at that time. But at least through now and until we have further guidance from California Department of Public Health, the expectation is that that all marine sports are following the state law. All right. On the testing. So this testing guidance is still the same. I have the link on the bottom to our interim guidance that is not changed at this time. So the first recommendation is that you would limit high-risk activities to only vaccinated persons. If that's not possible, we are strongly recommending that you have testing in the unvaccinated persons who are competing or participating in higher risk activities. And it would be weekly PCR or molecular testing. So that includes the ID Now, that's a molecular test that would be considered sufficient for weekly testing. But if using the rapid antigen tests, which is our more widely available in the school setting, it's twice a week testing. A true positive is a true positive. And so if someone is positive and asymptomatic, they should have a confirmatory PCR to confirm that it is a positive and not a false positive. And then a negative person and a symptomatic individual should also be have a confirmatory test in order to return to competition in sports. So this is different than what is in this. This is different than what's the standard practice in the community. And that's because these are higher risk activities, and the nature of these activities have a higher risk for transmission, which is why there's the recommendation that everyone should have confirmatory tests. So the positive antigen test should have a confirmatory test, and a negative antigen test and a symptomatic person should have a confirmatory test. Jump ahead. All right. And before we jump to vaccine, any questions around testing? All righty. So vaccine. So we are excited. Today's feels like Christmas to me. We have just received approval from the CDC. We're waiting approval from the state to move forward with pediatric vaccinations. So we have 2 goals that are related to this group. And I know most of you aren't over 65, but you'll see where it's related to you. But our goal is that 50% of eligible residents over the age of 65 receive a booster shot. We will continue to see more breakthrough cases with waning vaccine effectiveness. And we're also going to see more reinfections with people who have past infections and are not vaccinated. So the recommendation from the CDC is anyone that's had a past infection, that they themselves should get vaccinated because of the risk of waning immunity, especially if it's been more than 3 months, especially if it's been more than 6 months since you've had an infection. But it's recommended as early as you end your isolation period to get a vaccination for COVID-19. And that's because of research showing the effectiveness of vaccination and natural immunity. And then we're really recommending that everyone over the age of 65 get their booster shots. For the hospitalizations that we've seen in breakthrough cases are primarily among those who are over the age of 65 who had not been boosted yet. And then we've set a goal that 75% of our newly eligible children will receive their first dose within the month of authorization. So today we are expecting authorization. So by December 3rd, we hope to vaccinate 75% of our newly eligible kids. You can jump ahead. And this is the slide that I added because it's related to you. It's that most of you on this phone call, because of your participation in school activities and sports, would be considered at higher risk for occupational exposure because you're part of that education staff. So we would recommend that you talk to your healthcare provider around the risk and benefits of getting a booster shot, because especially now in the upcoming weeks, you do have may have significant, again, exposure to an unvaccinated group. And we have seen the age of people infected with COVID-19 decrease as, again, we have a highly vaccinated population. So COVID-19's goal is to find those unvaccinated folks. And as you all know, the majority of unvaccinated individuals in our community are under the age of 12. So again, just talk to your healthcare provider, and you don't need to talk to your healthcare provider. You can just self-identify, you can just present yourself for a booster shot at any of our sites. Jump ahead. And then pediatric vaccinations. The site will be updated today. We have another link to a site specifically around our pediatric population and information for them as families make choices around getting their children vaccinated or not. And Get Vaccinated Marin is the go-to site for any information on upcoming vaccine events that we have. And again, Northgate is always operating from Tuesday through Saturday. So you can drop by after school on most days if you want to get your booster shot at the Northgate Mall. Jump ahead. And then tonight we're going to be having more of a question and answer session. So in the past, our presentations have been slide driven, where we're presenting data on the safety and efficacy of vaccines. And tonight's meeting with Dr. Willis, myself, and Dr. Branco will be more of a question and answer, where we have a bunch of questions we've already received from parents of 5 to 11-year-olds, and we'll be fielding those questions and answering questions that come up on the chat. So again, it's more going to be a conversational event than the didactic presentations that we normally have. I think that's the last slide. Yep. So I'm really happy. I have, I see Linda Metz here, and I saw Sandra Rosenblum, and I don't know if Amanda's here, but I'm glad our nurses are here with me today. So
I'm here, Lisa.
There you are. Now I see you.
Yeah.
Great. So I'm ready for anything before we jump to any questions. Anything Sandra or Amanda or Linda you want to add based on the questions you've been receiving from our sports colleagues?
No, not really. Just want to mention that we are having a lot of positive people who are involved in sports, particularly club or competitive sports where there's some travel or a lot more large scale tournaments. So we are seeing sort of an uptick in sports related cases.
And that's what we're going to expect to see probably until December, is we'll see an uptick in cases, because it's going to take us, I don't know if I might have mentioned this. I'm doing a lot of presentations, so I apologize in advance if I already said this at this meeting, but people relax. So they get their first shot and then they relax their protective behaviors. So we're going to expect a run of sleepovers and other events that's really going to lead us probably to a significant uptick in cases through December. And December, if you think about it, if our kids are getting their first shots on November 4th, it takes 21 days to get your second shot, and then another 2 weeks afterwards to have full immunity from the vaccine itself. So it's not going to be until that second week of December where that 5 to 11-year-old population, that first batch, the first kind of cohort of 5 to 11-year-olds will have immunity from the vaccine acquired immunity. So we still have a good 5 weeks, probably closer to 6 weeks of lack of protection in this population, and more holiday gatherings, events, and changing weather patterns that move people indoors, and also that shift to indoor sports and some of those competitions that are happening at a field, so that they all will be contributing towards an uptick in cases.
Lisa, there's a question in the chat about the CIF statement, and why we're not considering, a question about asking why we're not considering basketball a choking hazard.
Because basketball is not a choking hazard.
Lisa, the other question in the chat, I'd like to understand why a mask is not required in a fitness center where individuals can complete a cardio routine, lift weights, etc., in close proximity to others, but it's required in school gyms where volleyball and basketball are happening.
It is where we are with the state is treating adult students who participate in sports differently than adults who participate in voluntary activities. So you absolutely are being held to a higher standard and expectation than we would expect in fitness centers in the county or the state. And that's, again, with a primary goal of preventing any interruptions to academics and instructional learning. And that's why there's a higher bar for sports as it relates to youth. And again, there may be changes. I don't believe there'll be changes from the state prior to the end of this year again, but there may be changes when and again, I especially don't expect it since we've seen the state now shift back to completely orange. And if not, we might be red by the end of today. So we're seeing increasing COVID-19 activity. So I don't expect the state to change its recommendation as it relates to sports until probably the new year. And once the state does change, then I would expect the Bajo and the Marin County to follow suit in our recommendations. But absolutely, there is a higher bar that's being held for student athletes than for adults who voluntarily attend gym.
Are the indoor attendance restrictions still in place, still the same? More than 1,000 attendees requires checking for vaccination or negative testing?
Yes, so if it's in a mega event, those requirements are still in place of vaccine verification or testing. So you would need to build that into your planning. If you want to really provide a safer environment and decrease risk of transmission, especially now that you are seeing the uptick in cases in our community, we would recommend considering a 50% capacity at your gym. So it's not that you won't have the need to have the vaccine verification, and you also would have a lower concentration of people indoors. And again, remember, we have seen breakthrough cases have high, even in individuals who are vaccinated who are breakthrough cases can have significant viral loads. And again, they are contagious before they become symptomatic. And so that's what we're navigating now. And that's one of the challenges of this vaccine, honestly, is that it's not a perfect match to Delta. So the data that we've seen for the pediatric vaccines is very reassuring. We saw significant reductions between the kids, the 5 to 11-year-olds who received the vaccine versus those who received the placebo. So we see it is effective. It's 90% effective in reducing the risk of COVID-19 transmission, but we're still kind of in this this is our last quarter of the game, getting these kids vaccinated. So we really need to make it through the end of this school year before we see more relaxation from the state.
There was a question about the Binax test kit's expiration, and Amanda kindly answered it in the chat, but maybe it's one that others would be interested in hearing about that haven't seen it in the chat. Seen the written approval for Binax Now test kits expirations to be extended, and can the athletic trainers start using the test kits we have?
I haven't seen it with my eyes, and I haven't seen Amanda's chat, but my understanding is that there's, in the school guidance, it's been written now that the expiration dates for those kits have been extended.
Okay, and thank you, Amanda, for your.
Yes. Oh, sorry, I just want to add, Marcia shared with me this morning that she has received the written extension, but it's really encouraging those supplies to be used as soon as possible.
Got it. I think that's it for the written questions in chat, but this is a format where anyone can speak up with a question. If they have one at this time, we encourage you to do so, please. Okay, well, it looks like all of the information's been sufficient for now, Lisa. So thank you, and thank you to the team from Public Health who's on this call and on so many calls with us. I know that this is just one of, I think, 5 presentations and calls that Lisa's going to be doing, all related to schools today. And so we are, as always, really indebted to the team at Marin County Public Health that is making all of this great work in Marin possible. And of course, to you folks out in the schools, the things that you're doing related to the sports and other activities that our students are in, we know how vitally important they are to the well-being of our kids. So thank you for what you're doing in very, very challenging times, because what you're doing is having a great benefit to the youth in our community. So with that, we will say thank you and talk to you soon. Bye-bye.